These are the general guidelines for the lower extremity program. It is recommended that the exercises on the mat be performed 3 times per week. If they can be incorporated either before or after practice or even before or after school, that will ensure that those exercises get in. We encourage our athletes, just for the sake of time, to do them in a circuit fashion. So do each of the exercises once and then repeat. Now, if an athlete is not able to do some of the exercises appropriately, we wait until their strength is strong enough, until their control is good, and they can do those exercises, they can add those exercises in. Now, in regards to the plyometric and jumping exercises, those can really be performed as part of the pre-practice warm-up. That way we ensure that those exercises are involved in the program, but a coach necessarily doesn't have to set aside specific time to do these exercises. We'd like them to do that, but we know how it is with kids and practice times, and how time is of the essence to work on their game. Repetitions. Each exercise should be performed initially 1 to 2 sets, build up to 3 sets as they're able to perform them appropriately. But we want to start anywhere from 8 to 12 repetitions as long as they're performed correctly. And then as an athlete gets stronger, we can either add resistance or increase the amount of repetitions that they perform. Typically 20 is the upper limit of what you need to do. If they're performing 20 repetitions easily, then we would need to add resistance of some kind through ankle weights or some resistance bands. The first exercise is a straight leg raise. It's a basic quadricep strengthening exercise. To make this exercise more difficult, you can add ankle weights as body weight gets easy. The way to perform this is you make tighten your thigh muscle, flex your toes towards your head, and then raise the leg up to the level of the other knee, and then lower it back down. Relax, re-squeeze, raise it up, lower it back down, relax, re-squeeze, back down. The key with this exercise is to make sure that the leg is actually straight and don't allow it to bend at the top or on the way down. First thing you do is raise the hips towards the ceiling by squeezing the gluteus, and then come back to the floor. Again, back. You should not have any hamstring cramping or tightness with this. If you are, that indicates that you do have some gluteal weakness and that you're using the hamstrings too much. To progress this exercise, you can go to a single leg bridge. So you would raise one leg and come up like so. Back up. This is the clamshell. The athlete lays on their side. The hips are flexed to about 60 degrees. The ankles stay together, and not rotating the pelvis backward, you raise the top knee towards the ceiling and then back down. We don't let the knees come back together. You keep the leg parallel to the floor to keep tension on the muscle. Up, down, up, down. And again, it's very important that you don't roll the whole hip backwards. It defeats the purpose of the exercise, and it allows muscle substitution patterns to take place. This is the sideline leg raise. This is a key exercise for gluteal development. What the athlete does here is they straighten out their leg. Now, if you're at home doing this and you have access to a wall, like I do here, placing the leg along a wall and putting the heel into the wall will have a greater emphasis on this particular muscle. If you're not near a wall and you're at practice, having a teammate or a coach guide the movement to make sure it's done appropriately will work well. The shoulders, the hip, the knee, and the ankle are all in a straight line. The tendency to cheat with this exercise is to bring the hip forward, and you're using the wrong muscles for this one. You should feel this just behind that side hip bone here in the side of your glute. You're going to raise the hip up along the wall, and then back down again, making sure that you stay parallel to the floor like some of the other exercises. We want to keep the tension on the muscle. Again, and then down. This is clamshell 2. If you recall, clamshell 1 was 60 degrees of hip flexion, raise the top leg, and then back down. Now clam 2 is the exact same position, except you raise the leg, again parallel to the floor, and pretend like you have a can of soda sitting right here. So if you lose, or if you cheat, it's going to spill. So we want to stay nice and level here, and then you rotate the foot towards the ceiling. Again, keeping the leg elevated. Athletes should feel this in the side of the hip again. Same rules apply. We don't want the pelvis to rotate backwards. This is the side bridge. This is also an important exercise for gluteal development. The shoulders, hips, knees are all in a straight line. You rest on the elbow and then raise your hips towards the sky and then back down. When you've had successful completion of this exercise and it's easy to perform, you can straighten the legs and perform it the same way. Athletes should feel this on the bottom hip and the side of the trunk. The next exercise is called the plank. It's a common exercise used for core stability, but many athletes do this incorrectly. So as a coach or a parent, my suggestion is to consider watching your athlete do this with their elbows on the back of a table or on the back of the couch, because the more horizontal you get on the ground, the more difficult the exercise is. But for the ease of demonstration, I'm going to show this exercise flat on the floor. Some of the keys to think about when performing the plank is that the hips and trunk should be actually in a straight line. Oftentimes we see athletes do this and their hips are up in the air. That is incorrect. We also want to make sure that their low back doesn't bottom out. Oftentimes they don't have the strength and stability to hold the position, so the longer they hold, the more their back bottoms out. Again, the back should be in a straight line. We want to emphasize while they perform this exercise that they squeeze their gluteals and that they keep their midsection tight. We tell athletes to kind of draw their belly button towards their spine and brace themselves like they're maybe about to get hit from an opponent. So to show the plank, the belly button is in, the glutes are squeezed, and we should be in a nice straight line. And you hold the position. A good starting point is 10 to 15 seconds, and as athletes are able to hold longer with good form, you can increase the hold time. To make the plank exercise tougher, because as athletes train and get stronger, you will need to make this tougher. You can have them raise one leg and hold, or they can alternate raising legs one at a time. This is a side plank. This is a little different than the side bridge before, because the side plank is more of a core stability exercise, similar to the plank. What you'll do here is, the knees are bent, the hips and shoulders and knees are in a straight line. You raise up and hold the position. Again, the glutes are squeezed, the belly button is drawn in, the midsection is braced. To make this exercise more difficult, as an athlete is able to hold, you can straighten the legs out and raise up again and hold. This exercise is called the fire hydrant. It's good for gluteal development. If anybody has a puppy at home, when you see me perform this exercise, you'll know why it's called the fire hydrant. Here we get in an all-fours position on hands and knees, and we just raise the outside knee towards the sky. Athletes should feel this on the side of the hip. And we don't want to go too far where we're rotating the whole body. We want to isolate this to the hip. The next exercise is a common core exercise called the bird dog. When we do this exercise, we want to make sure that, again, we stay level through our pelvis. Like we said with a couple previous exercises, we want to pretend there's a can of soda sitting right in the middle of our back. And if we cheat with this exercise or do it incorrectly, our pelvis will rotate and will spill. Initially, for an untrained athlete, this might require some cueing from a coach or a parent. So we draw the belly button in and we raise one arm and raise the opposite leg, kicking straight back. And making sure that the back stays level. Ways to compensate or cheat on this exercise are raising the leg too much, or as stated previously, rotating the pelvis too much and dropping. This is an exercise where an athlete probably won't report that they feel a burn or feel muscles working really hard. This is a core stability exercise.